survivor. I also have the honor of serving as the vice president of the board of directors of Komen, North Carolina, Triangle to the Coast. Here at Komen, we work to save lives by meeting the most critical needs of our community and funding breakthrough research to prevent and cure breast cancer. We currently support 29 counties across Central and Eastern North Carolina. Thank you again so much for joining us. We believe at Komen that it is important for breast cancer patients, survivors, and those living with metastatic breast cancer to be as informed as possible. In honor of this year's Survivorship Week, Komen NCTC has teamed up with our Triangle Race for the Cure presenting sponsor, Duke Cancer Institute, to explore breast cancer and survivorship. We hope you find this information very useful. Now I'd like to introduce our wonderful presenters to you today. First, we have Valerie Worthy, MSN RN. She's a 21-year breast cancer survivor, and she has been a registered nurse for 38 years. Currently, she is a patient navigation manager at Duke Cancer Institute. In addition to her work at Duke, Valerie collaborates with community organizations across North Carolina to raise awareness about breast cancer and its impact in the local community. Thank you for joining us, Valerie. Next, we have Ms. Susan Dent. She's a medical oncologist at Duke Cancer Institute, specializing in the treatment of breast cancer. She is the Associate Director of Breast Cancer Clinical Research and the Co-Director of the Duke Cardio-Oncology Program. She's currently leading a number of research projects at Duke, including a study examining the cardiovascular consequences of cancer therapy, including fatigue and exercise capacity in women receiving cancer therapies in early stage breast cancer. Ms. Dent is recognized nationally and internationally for her ongoing efforts to improve the cardiovascular health of cancer patients and has also recently been awarded the Thomas Force Leadership Cardio-Oncology Award. Congratulations. Since arriving at Duke University nearly 2 years ago, Dr. Dent has worked to improve access to clinical care for any cancer patient who has a pre-existing cardiovascular disease or develops cardiovascular disease related to their cancer therapy. Last but not least, we have Cheyenne Corbett, PhD, LMFT. She's the director of the Cancer Support and Survivorship at Duke Cancer Institute. She received her MS and PhD in marriage and family therapy with a specialization in medical family therapy. Her area of expertise is psychosocial care of patients diagnosed with cancer and their families. Her research involves learning about how cancer impacts patients, family members, and their relationships. She also designed and oversees a psychosocial oncology training program for master's and doctoral students that prepares these clinicians and researchers for careers in psychosocial oncology. Dr. Corbett presents regionally and nationally in the areas of distress screening, management and oncology care, the family experience of cancer, and the social. I had practiced this word all day long, so please bear with me. The psychosocial components of cancer care and clinical supervision. Thank you so much for joining us, ladies. So during the registration process, you submitted questions for our experts, and we want to answer those questions during our discussion. Now, following this, our panelists will also take some additional questions live. So please submit any questions that you have during the presentation today in the chat box. So now we're going to go ahead and get started. So my first question is going to be to Dr. Corbett. Some patients have expressed concerns specifically about their anxiety and stress related to fearing their cancer coming back. They've also expressed concerns regarding whether or not, these topics can truly be addressed during the telehealth appointments. What advice do you have for patients who have been treated in the last year or in a year or less, and about their concerns about these telehealth appointments? Dr. Corbett.
Thanks, Teresa. Can you guys hear me?
Yes.
Okay. I think this question actually is a great question. We are hearing it a lot right now as everyone on this call knows, those of us who haven't spent much time on Zoom before, now we're spending a lot of time on Zoom. The way we're providing care has really changed over the last couple months. But I think this is a question that can also Dr. Dent and Ms. Worthy can weigh in on. What we want to do is reassure our patients that our health systems are doing everything we can to help continue to take the best care possible of our patients and our loved ones. And while we've never faced something like COVID-19 before, the systems have really rallied and made a lot of changes very quickly in terms of how we provide our care. And that does, in fact, include more telehealth. And that's unfamiliar for a lot of people, as I mentioned, because we don't typically spend a lot of time on platforms like Zoom, or certainly thinking about talking to our physician or our nurse via that platform. But the teams, Dr. Dent and others, have worked really hard to ensure that we are making informed decisions about what care needs to be provided in person, what can be provided via telehealth, and working to make sure that we're addressing the continuing concerns as well as health needs of our patients. And so this certainly is requiring not just our providers and our clinicians, but our patients and our loved ones to adapt to receiving care differently. And what I would say is to continue to voice questions, concerns within the context of those telehealth appointments. Your providers want to know how you're doing, how you're feeling, what you're struggling with, what's going well. And they need you to be able to tell them those things. And that doesn't mean that they're going to spend, they're gonna listen to you, hear you, and address your questions or concerns, and then also connect you with resources within their teams to be able to help, especially if there's increases in worry or anxiety or things like that around all the changes that people are experiencing. So most institutions would have folks like chaplains or clinical social workers or navigators who your doctor or nurse would connect you to in addition to themselves to help address your concerns and questions.
Thank you for that. So Dr. Dent, could you share what patients should expect during their first televisit and what would be different in their care?
Sure, thank you. And I think this really builds on what was previously said, is that the team here at Duke has really worked hard to try and make it very easy for people to join into these video visits, recognizing that not everyone is technically as savvy as some others. And so you'll be contacted by a member of our team, and they'll try and help facilitate you how to get onto a computer and explain a little bit about how you get into this virtual room. So essentially, what a video visit entails is that we meet in a virtual space. So I can see you, you can see me, a little bit similar to the Zoom call, and we can have a conversation in that space, video sort of common space. And then, similar to what would happen if I saw you in the clinic, we have a conversation. We talk about you and your history and why you've come to see us. And many of the things that would happen if you were physically here happen through that video visit. So I'd say the experience is somewhat similar. Of course, you don't have that, personal interaction, which is also always nice. I can't sort of physically put my hands on patients, which is always somewhat of a challenge. But we can come up with a plan, and we can talk about the resources that we have, and we can do everything that we would normally do in a physical visit. And I think this is really important to reassure people that they're not losing out, that they're not going to get less care through a video visit. I can tell you that, I moved here almost 2 years ago from Canada. And because of the distances and the weather we have in Canada, we have been using more video visits over the last several years. And it's proved to be a very valuable tool to help with patient care. And to be honest with you, as we sort of learn how to work with and deal with COVID, I think this is going to become a part of our daily lives. And that video visits and how we accomplish and patient care is changing, and it's changed forever. We will continue to be reaching out to people using video visits.
Thank you so much for that. And as someone who has had some televisits recently to as a part of my ongoing cancer follow-up treatment, I was pleasantly surprised about the attentiveness. So I would definitely agree with you. So now I want to go back to Dr. Corbett. You know, COVID-19 has been a difficult time for all of us, and it's affected how, you know, we treat patients in the breast cancer community. And, you know, survivors have expressed anxiety related to feeling like they're out of control. You know, you have this diagnosis and there's a lot going on. And then there's this given uneasiness about, you know, completing treatment. And during this time, have you heard that from your patients? And what can we do to help these patients express their concerns, and where can they go for help?
Thanks, Teresa. Yeah, I think actually my answer is probably similar to the first question. I think anytime somebody faces something that's as life-changing as a cancer diagnosis and treatment, there's definitely going to be a sense of feeling like you have less control or feeling like you want more control. And I think those are certainly normal things to experience, and you might feel that more or less at different points in your treatment, as well as during survivorship. And I would just say again, I think communication is one of the most important things. Communication with your care team, so folks like Dr. Dent and your nurses on your care team. You know, again, sort of if you have questions, I think oftentimes people sort of have this sort of general feeling like there's that they have a sense they don't feel as much control, but it's helpful to sort of narrow down and think about what that specifically is about. Is it about you know, for instance, feeling like you're not part of your care decisions? Well, those are things that you could talk to, for instance, Dr. Dent or your provider about how to be part of that and what makes sense, and how to communicate what specifically your concerns are so that the team can address those appropriately. So I would say that communication is really important. And I would also say that, you know, facing something like cancer and cancer treatment and into survivorship is something, as I mentioned, very life-changing. But we also know that people who face cancer every day, breast cancer patients, breast cancer survivors, people coping with metastatic disease, are a strong bunch of people. And they have a lot of internal strengths and resources that they can tap into during this time. And I would encourage people to continue to look for those and tap into those strengths and resources. And I guess, as I mentioned, sort of like I said in the first question, it is communicating with your care team and knowing what to expect. What are those things to expect in terms of your cancer treatment, the timing of appointments, if you're having labs done or scans, and all of that helps you know like what is ahead, so you can plan for it and you can sort of set your expectations. Again, I would also encourage people to reach out to resources within their institution or in the community. There's some terrific community support groups, and that will help also sort of connect with others and see what they're thinking and what strategies they use, and to help them feel more in control as well. And probably related to that is continuing to keep up with all of your healthcare needs, right? So Dr. Dent is an expert in cardio-oncology, and probably one of the things that she's right about to say is make sure you keep up with your general health needs. Like paying attention to those things is really important. And that's something that you can continue to focus on, and your overall wellness. So things like physical activity, and increasing that, and social engagement and things like that. Those things that you feel like you do have elements of control of, but that also help you feel better as well and help you cope with those uncertainties or anxieties that people might be feeling.
You know, thank you so much for addressing that, because the social and the psychological component of breast cancer is hard enough, and so people really need to tap into their resources. Okay, so now we want to talk to Ms. Worthy. We want to talk about, another concern. You know, patients have this concern about, job security while they're going through treatment. They're also concerned about, the debt that they're experiencing. What advice do you have for patients who are facing concerns about job security and medical bills? Where can they go for help?
So, Teresa, being a survivor yourself, and I'm a 21-year survivor, the last thing that we need to worry about is our job security, which actually is attached to us having insurance and then being able to have that coverage cover our treatment, and then have to worry about mounting bills. I think that a patient that is diagnosed with cancer needs to concentrate on health and healing and not have to worry about all of those other things that add a barrier and stress to their lives, and not only their lives, but their caregivers as well. The first advice that I would give is for that individual to look for a navigator or a social worker. Let them do the work for you. They're trained to do it. They know what resources there are out in the community. They can do the legwork, stay on the phone, fight for you. And part of what we do as navigators and social workers, we are advocating for that patient. There are many services, not only in your local cancer center, but there are also services like American Cancer Society who can connect you to resources. There's a patient advocacy program that connects you to resources. And in addition to that, Duke has a legal program with our students and our law students, and they can also help you in terms of questions you may want to ask your employer or things you might need to do to protect your job security. Now, because you've been diagnosed with cancer, they just can't say, I'm going to fire you because you've been diagnosed with cancer. That's just not happening. But I don't think that anyone needs to worry about all of these things when there are trained individuals to do that for you. And so I would encourage someone to look for your navigator, look for your medical social worker, because those individuals can help you along your journey.
Yes, and I would agree. My navigator was such a source of comfort and also direction for me. So yes, that's great advice. Another thing too that we talk about during the whole breast cancer thing is, as a support group, what suggestions do you have, in regards to finding the right group for a person? That was a question that came in from one of our participants.
That's a really good question. And sometimes we kind of struggle with that because we do want to have, as cancer survivors, we do want to have someone that can finish our sentences. We want to go to a place that's safe, and we want to be able to, let's say, take off our wigs and just be who we are. And with our families and caregivers, we don't want to frighten them. So there are questions that we have that we know that other survivors who have walked the journey can help us to kind of navigate some of those things and then validate some of the feelings that we have, our fears, our apprehensions, and so forth. But you just have to really be careful about support groups. What do you actually want from a support group? Some support groups are led by a trained individual that understands all the nuances of support group and the social support, and they'll keep you, within what they think is right and safe. And then other support groups are just what they are. They're support groups. You kind of feel good and people share and all of that. So you have to really know what you want and what kind of education you want them to provide, because there are groups that strictly provide education, and that's good. But know who you want. I mean, they even have a lot of support groups now, even online. So maybe some people don't feel comfortable with the face-to-face kind of interaction, so they can go online and do that. But just be careful. And it's okay if you go one time and you're just not feeling that, then you don't have to go back. There are tons of other resources. Duke offers a ton of supportive groups, and our patients love it. I run a nonprofit support group for African American women with breast cancer. We're in Durham and Raleigh. People love that. So I think there is a lot of opportunity for people to get the support that they need.
And thank you for that. And I like what you said. You have to try things, because just because the first support group doesn't work out doesn't mean that, you haven't found that sweet spot.
Absolutely.
So keep looking.
Yes.
Thank you for sharing that. I want to go back now to Dr. Dent. In the age of technology and information, people are seeking a lot of information, and especially for someone that's young and recently diagnosed with breast cancer. What advice do you give them about genetic testing for them and their families? Are there certain criteria for a referral? People want information, and so what advice or direction would you provide to them?
I think it's important, first of all, to realize what places individuals at risk of having a genetic mutation and their families at risk of developing a cancer. We know actually that about 5 to 10% of all breast cancers can have a genetic link. So by far, I think the other point to that is by far most of the breast cancers that we see are not genetically linked. But for those individuals who develop breast cancer at a young age, and by what do I mean by young? Less than 40, for those individuals who have a certain type of breast cancer called triple negative, which means they don't have an estrogen, progesterone, or HER2 receptor. For those with families that have multiple first-degree relatives with breast or ovarian cancer or male breast cancer, these are sort of what I would call as red flags to us that those individuals are at higher risk of having a genetic predisposition to developing breast cancer and or their family. And so we are fortunate here at Duke to have very good genetic counselors. If people fall within one of those sort of risk categories, we will refer them to a genetic counselor. And not only will they discuss with those individuals, what type of testing that they're going to do, but I think more importantly, when that tests come back, they need to sit down with those individuals and describe to them, what does this mean? What does it mean if I don't have this mutation? What does it mean if I get back these weird things on my report saying variant of unknown significance? What does that mean to me as an individual? What does it mean to my family? So I think it's really important not just to be able to have the test done, but to have the counseling that goes along with that test, because that's ultimately very important, particularly if you have a mutation. And I just want to say one other thing is that, women come to see me and they say, well, why do I need to have this test done? I've already got breast cancer. Why would it matter to me? Well, two reasons. First of all, if you have one of those mutations, you are at increased risk of other cancers like ovarian cancer. So you may have the breast cancer, but we're worried that you may go on to develop an ovarian cancer. And secondly, it's for your family and your family members to see if they then need to be tested and are they at potential risk, a higher risk of developing a cancer. So knowing the high risk groups, we can refer individuals to these counselors, and more importantly, having a good conversation about what that test results mean. And if you are in one of those groups, how do we monitor you, and how do you going into a surveillance program to try and, pick up a cancer if it occurs early.
Thank you for sharing that. And as a triple negative breast cancer survivor, the genetic testing was really important for me and also for my family members. I have a younger sister. So, we are here today, most of the survivors, and then also the NBC individuals, because someone went before us and they had some treatment and they sought out information. So whatever we can do to contribute to the effort to cure breast cancer, we do it. So thank you for sharing that information. Also, I want to go back to Dr. Corbett. One of the things that, is important to us as women is how we look. As I've sat in my house for the past 3 weeks and haven't had my hair colored or done, as you can tell by the different colors of gray up front, what conversations do we need to talk to women about who are struggling with their appearance during treatment?
We get that question a lot, and it won't be a surprise to you that I answer it in this way probably, but I think everybody's different and everybody's experience of that is different. And breast cancer treatment can affect people in a variety of different ways, whether you had surgery or chemotherapy or radiation therapy or hormone therapies. Those might affect how you feel about yourself, how you feel like you look, how you feel in terms of your body image. And those are important changes that, again, are important to know what questions you have, and then also who you can address those questions to, like Dr. Dent or a nurse on the team or your navigator. And I would say that it's really important. For those of you who know me, we've developed a self-image program at Duke, and that was one of the things that I actually put into place from the very beginning, because I know that everybody's experience is different and everybody's experience is personal, right? So I wanted a safe space for people to be able to come and ask their questions and receive education, accurate information, as well as resources to help support them. And one thing you'll hear on our team is that we want our patients, our survivors, our folks coping with metastatic disease to feel comfortable in their own skin. And what that means is some people might prefer, for instance, if they've lost their hair, they might prefer to wear a comfortable scarf, or they might prefer to wear a turban, or they might prefer to wear a wig, or it might change depending on the scenario, if they're at work, or if they're at home, or if they're at church, or if they're at kids' school. And for us, the important thing is that they feel comfortable in their own skin. So when we actually have developed a self-image program, including boutique locations at each of our cancer centers, so that people have a place where they can actually go and talk to, and we actually developed a role called self-image consultants. So these are people who are particularly trained to help, again, educate and support through those changes that people are experiencing, men and women. And so what I would say is that it's important to have a space where you do get information, you know what to expect, but you also know about what resources are out there, but also, again, to really focus on what, how you can be comfortable, what makes you comfortable, because a lot of what we do tends to be about other people. I'm wearing a wig to make somebody else comfortable, or I'm wearing a hat to make somebody else comfortable. And I would really encourage folks to focus internally first and see what makes sense to them. Because wear a wig or rock a bald head, it should be up to that person of what makes them feel comfortable. And sometimes, like I said, the changes are also about, again, how other people, you worry about what other people might be thinking. And so what I would say is, oftentimes people have sort of fear of those unknowns. So to be able to talk about it, or talk about it within your family, for instance, kids or grandkids, if you have a change in physical appearance, oftentimes what people are concerned about is what their kids might think, or their grandkids might think, or the people that they interact with. And so again, those are about conversations and also feeling comfortable in your own skin, so you can answer questions, or you can feel comfortable with the changes that have taken place as part of your treatment. I would also say, in addition to resources like our self-image consultants and our boutique locations, which are available to the general community, not just Duke patients, that those are questions that I would also address, again, with your care team, with your social worker, or with a medical family therapist, because sometimes it goes more into sort of how you see yourself and the meaning that you're attributing to what you're going through. So I would encourage you also to talk about folks, and we have folks on our team, they're called medical family therapists, and their role is to really help address all the different ways that a cancer diagnosis or treatment might affect your life. So there's folks there who can help talk through this as well. And I think that those are important considerations, and also, again, knowing about what resources are out there, and then connecting and not feeling uncomfortable talking about these things, because you're not the only one experiencing changes, and it's important to know that there are others out there who maybe experience something similar.
That is so great, and thank you for sharing that. I mean, as myself and other women have gone through this whole process, you want to know what's the right thing. Should I wear a turban? Should I wear a wig? What should I do? And just to hear someone say it's okay to do whatever works for you, it's a whole thing. And then also sometimes how you feel about that apparatus that you have. I mean, a lot of times I did find myself wearing the wig or the turban for other people, because you're going through enough, and that you don't want to make people feel uncomfortable. But again, going back to what you always talk about, it is about how you feel about yourself, because people need to be in a place where they can heal and focus on themselves. So thank you so much for pointing that out. And, as we talk about our different body images and how things change, I think another thing that's important is that, another taboo subject that people don't always talk about is the changes that we have in our sex lives during the treatment. Is this normal? Do you have any advice, Dr. Corbett, that do about this? Did we lose Dr. Corbett?
Sorry, it might be my internet. Somebody might need to answer that. Dr. Dent, maybe? Or
we can
Valerie?
hear you now.
Oh.
We have you.
Okay.
We can hear you.
So I didn't hear all the question, though, so perhaps Dr. Dent or Ms. Worthy could start answering, and then I can chime in. I apologize.
I can just talk a little bit about that. Of course, sexual health is what we're talking about, and what happens as women go through their treatment. And I think it's something that we probably don't pay as much attention to as we should. particularly for our younger women who are premenopausal, and then with the treatment that they give them, all of a sudden they're thrown into menopause and they're dealing with hot flashes, decreased interest in sex, vaginal dryness. And so not only are we assaulting them physically with all these chemo drugs and the side effects, but we're really changing their sexual relationship with their spouse or significant other. And so it is something that we, try and address more often. We actually are very fortunate here at Duke to have a sexual health clinic. So it's run by actually one of our medical oncologists, Dr. Kelly Westbrook. And so for those patients who are really struggling, I refer them to her clinic and her group, because I think it's more than a 5-minute conversation. And that I think it's a separate discussion with a group of individuals.
Hello?
We seem to have lost Dr. Dent. Can you hear me?
I can. I thought it was me for a minute.
No,
Okay.
for me, her screen has frozen, but you, Valerie, and Cheyenne still seem active.
Okay.
So she may end up restarting to join us, and we'll go from there.
Okay. Was there anything else you'd like to add, Dr. Corbett, about sex life?
I couldn't hear all of what Dr. Dent was saying, and I'm not sure if Valerie, I'm sorry, my connection might also be a little bit at the moment with the weather outside. But in addition to what Dr. Dent mentioned, we also have at Duke trained sex therapists, as well as our medical family therapists who also trained in sex therapy, so they can really help. In addition to the clinic hosted by, or in addition to the clinic run by our medical oncology team, we do have additional resources that can help talk through the changes that people are experiencing in terms of their sexual health or intimacy. So that includes, of course, physical functioning, but also that relationship component, the intimacy component. And so we really take sort of a whole person approach, a whole relationship approach, and really be able to work with our patients and their partner to help them address any questions or concerns that they would have. And we do work multidisciplinary as part of the multidisciplinary team with Dr. Dent and the other oncology team members as well, to make sure that that whole picture is taken into account, the physical as well as the emotional and the relational components to that as well.
I think that's really important. The women who are experiencing or have gone through breast cancer are already dealing with a lot. And then, with the changes in your body image, and then, you're feeling sometimes less than a woman. Anything that we can do to get back to that normal life is so helpful. So thank you for making those resources available. I want to pivot a little bit now back to Ms. Worthy to talk about, you have a person, they've completed their treatment. What else is available for them? Because, along that way, that path, you have a wonderful care team that's working with you. But once you've completed therapy, a treatment, what's out there available for kind of that aftercare and that follow-up?
Okay, so let's step back a minute. Let's think about this, Teresa. So all of us want to start our treatment, and we really want it to be done like really quickly. So we get to that moment where it's our last treatment, and then you go back to see your oncologist, and they're going through the survivorship plan and all of that. And to your surprise, you are nervous, like you are afraid, because now you don't go back to see your oncologist, like maybe for 3 months. And you're saying to yourself, so what am I going to do? Like, you are really frightened. So I don't know if you guys remember filling out a distress screening sheet where they ask, about your distress and what you're concerned about. Studies of those kind of concerns that people have show that our distress probably is just as high when our treatment ends as when it begins. So if you're feeling apprehensive about just your little bit of separation from your oncologist and the medical team, I think that's the opportunity, as Dr. Corbett talked about, our medical family therapists, they can really help you with coping skills and you dealing with like that separation from your medical team, and also help connect you to some resources along with your social worker and your navigator, to sources that will help you in the community. So there are oftentimes, Live Strong has exercise programs. They have programs in the community for yoga and mindfulness and all those kinds of things that kind of help us decrease our stress. Again, I talked about support groups, which I think they are really, really good. There are so many resources in the community that will help. This is the crazy thing. So when you get radiation, I got radiation. I went Monday through Friday for 30 treatments. And I noticed the same individuals were there at the same time. So believe it or not, I formed friendships with some of the other breast cancer survivors. So every year, and this has been going on for at least 20 years, I may not talk to that person throughout the year, but we know that we will see each other every year at the Komen race. So those are kind of relationships that, you know, they start in the hospital, and because you have, I mean, in the clinic, and you have these, you know, common concerns, but the bond is so strong that even out in the community, you can continue to form these relationships. So that I encourage people to use the resources that are in your cancer center, in your clinic, but then also have your social workers or your navigators to help you connect with some resources that are out in the community. And just understand everyone goes through this kind of separation thing. I mean, it is so normal. If you didn't, I would be a little bit concerned. So know that that too shall pass, and finding those resources in the community can go a long way toward helping you with that separation piece.
That is a really, really good point, because I did not want my oncologist to let me go. I kept saying, "Are you sure I can't come back and see you again?" Because those people become your family, the people that you see in your treatments, and then you know that you're getting the best care, and you get that no evidence of cancer, or you get that you're stable, and you want to just stay connected. So thank you for that. That's very important for people to go out and look for other things. And so now I want to take it back to you, Dr. Corbett, with your focus on family and looking at things kind of holistically. You've completed treatment, and again, you're having that hard time coping, and your loved ones are kind of saying it's time to move on. And, what is support is available for that family resource, and also to help your loved ones understand that maybe it's not time for me to move on.
Yeah. Well, like Valerie said, one of the unexpected things that I think people experience is that sometimes they feel more stress or more anxiety once they're completed treatment, because you sort of, you prepare yourself and you rally, during treatment, and you're doing everything, and then when your treatment ends, or there's perhaps it's different, or there's additional time between when you're seeing your oncologist. Those are times that sometimes people feel, like Valerie said, an increase in stress or increase in worry, or and it goes back to one of the things I mentioned earlier, is that everybody copes differently, right? So while somebody might still be thinking about their cancer because you just went through a very challenging experience that impacted probably all facets of your life, that doesn't just flip a switch and turn off once you've completed your last treatment. Or, like I said, if you're continuing through treatment, or changing the time frame between you and your seeing an oncologist, that doesn't just flip a switch for a lot of people. But again, everybody is different, and what I would encourage people to think about is sometimes when people are saying things like expecting people to have moved on or to be in a different place, that again, that might be how they cope with it. They might even think that they're being helpful and celebratory, that, hey, we've closed this chapter and now we can move on to the next. And so I would really encourage people to talk to one another and sort of not assume any meaning to any sort of actions or even words, because you don't know exactly what that person means. And maybe they think they're being very supportive of you. And like I said, maybe they're being feeling like they're being celebratory, that perhaps you've completed treatment and now you can move on to something different. But what that also doesn't account for is that a lot of times when people go through, for instance, a breast cancer experience, it also changes how you see the world. It changes what you perhaps put value in or find meaningful. And so that will often change. And so while some things might have been meaningful or a focus for you before your diagnosis, that might change. So we see folks who increase perhaps, who continue to focus on their cancer, but it might be through volunteerism, or it might be through attending support groups, or it might be through participating in Komen events. So breast cancer might still be part of their lives, but in a different way. And so sometimes that's hard for other people to understand, because they think, well, don't you want to just put it behind you? And, again, that's where I think that it's really important to understand people's different perspectives, because that might be a new way that that person, might continue to find meaning in their life. And, cancer might still be part of their life, but in a different way, but in a way that might help them continue to cope, or frankly, help other people who are being newly diagnosed, or who or coping with cancer as a chronic illness. Like, they might stay connected for those reasons as well. So I think it's really important for people to take a moment and actually communicate about what they mean when they say either moving on or getting past. What does that actually mean? And saying, actually, no, this is really how I'm dealing with it currently, and these are things that I have found to be helpful. And to be able to have those types of conversations, I think, is really important, so that we don't just automatically judge people's reactions or how they're coping, or that we feel like they're not coping properly.
Thank you for that. Did Dr. join us back?
I'm here. I'm here.
Okay, great. In this trying time of the COVID pandemic, we're all having to do things a little bit differently, with social distancing, with, telehealth, and also getting together via Zoom. Talk to us about what are your recommendations for someone living with cancer during this time? What precautions should they be taking? What advice do you have for them?
I think that's a really good question, because one thing that we have noticed is that many people are afraid to come to the clinic or the hospital, even if they're having, perhaps an issue that would normally bring them to the hospital, whether that be a fever or just not feeling well. I think everyone is scared about, accessing healthcare because of the COVID crisis. What we have been telling our patients is, particularly those who are in active treatment, is to take precautions as you normally would, i.e., stay away from people who are sick. Of course, now with COVID, avoid large crowds, wear your mask, when you do go out and you are having to go out to get, groceries, or ideally get someone to get them for you. So really, taking the precautions that many of us who are not afflicted with cancer undergoing treatment would be taking. More importantly, though, I just want to reassure people that it is safe to come to the clinic to see us. Everyone who comes here is screened. All the staff are screened. All the patients are screened. Your temperature's checked in. Everyone in the clinic is wearing a mask. And so as we start to reopen up our clinics, I want to assure people that we are taking all the precautions to make you able to come here for a safe visit. If we feel that you don't really need to see us physically, then we will go back to saying perhaps you can have a video visit or a televisit. And so we are now moving forward trying to differentiate who needs to come see us and who can get a video visit or telephone visit. So I think moving forward, we're going to have 2 streams of follow-up. Those will be the 2. And most importantly, if we feel you need to come to the hospital or there's something for which you need urgent medical attention, please come. Do not, avoid coming to the hospital because you're scared that, you might pick up COVID, because I think not only in the cancer world, but also amongst my cardiology colleagues, they're saying that people are not coming to hospital when they have chest pain, when they really need to come. And I'm afraid, that people are going to get into trouble at home because they're too afraid to seek some of the urgent medical attention that they need.
Thank you for that. Another thing, back to you, Dr. Dent, can you share how research dollars are distributed towards the stages of breast cancer, and any progress that has been made or the lack thereof in reducing the reoccurrence or the progression of stage 4 metastatic breast cancer?
So that's a really complicated question. The reason why is that, as you know, there are many groups that support breast cancer research, whether that be a not-for-profit organization, whether that be cooperative groups that are mainly supported by the government, such as the National Cancer Institute. And of course, there's pharmaceutical companies that also conduct research in breast cancer. And each one of those organizations may have a different emphasis on what they fund. So pharmaceutical companies tend to fund perhaps a bit more research in advanced or metastatic breast cancer because they're trying to find, a treatment that they can use quickly, that they can get onto the market. Cooperative groups tend to maybe look a little bit more at earlier stage breast cancer trials because they're interested in the science and they want to improve or decrease the risk of women developing advanced disease. And then there's the not-for-profit sort of groups that, may decide that of the whole scope of breast cancer, this is one thing that they want to focus on and they want to support, this aspect of breast cancer research. So it's difficult for me to sort of say, of all those groups, where do the dollars go? I think the bottom line is that there's active clinical research going on in all aspects of cancer, right from early stage through to advanced breast cancer. And that has meant, we are making advances. And just in the last few months, we've had 2 new drugs approved for women with HER2-positive advanced breast cancer. Rapid FDA approval after data was presented in December of last year. So we are making advances. Of course, those people living with advanced disease would like us to find, a cure. I know that. We're not there yet. But I think having been in this space for over 20 years, I'm happy to say that, women are living much longer with advanced disease than they used to. Median overall survival used to be 2 years if you were diagnosed with advanced breast cancer. And now for some women, we're moving it out 6, 7 or more years based on some of the therapies that have been developed.
Thank you so much. And as I stated before, we were going to allow time for you to submit questions. So at this time, Krista, have we received any questions from our participants?
We have.
If you have any questions, please type them in and raise your hand.
Exactly, we have. So I am just trying to catch up. Let's see here. The first one that we received is, hold on one sec. There's someone that says there is definitely, one-stop shop for all of the medical treatments and things that go involved with cancer treatment. Is there any potential for there to be a one-stop center for survivorship help resource, face-to-face programs, mental health classes, exercise, beyond?
I'm not sure who wants to take that question on, but I can tell you that from my perspective, having only been here for just under 2 years, is that Dr. Kevin Opfinger came here, was recruited here from Memorial Sloan Kettering in New York to set up what I will call a more formalized survivorship program. And part of that is actively engaging primary care physicians to be more active participants in survivorship care. And also part of that is to look exactly what you're saying and set up a more sort of consistent and uniform resources where patients would have access to things all in one area, such as exercise groups specifically for cancer patients, support groups, follow up for their cancer, and so on. So we're actively looking at that. It's not established at this point, but recognizing that it's a really important part of what we need to do.
Mm-hmm. Yeah, to add to what Dr. Dent said, Kevin Opfinger is my partner in leading our supportive care and survivorship center, and Ms. Worthy's navigation program is part of that center. And what we've done over the years we've really created a comprehensive cancer support as well as now survivorship programs for our patients and their loved ones. So as Dr. Dent mentioned, everything from physical therapy to psychiatry to family therapy, child life, rec therapy, patient navigation, tobacco cessation, pretty much anything that we have found that patients that it could help them through their cancer experience, could help their families. We've created those resources internally to help support our patients and their loved ones. And over the last couple of years, have made significant advances with Dr. Effinger joining the team to work with our partners in the disease groups, such as Dr. Dent and others, to formalize more around the survivorship clinical services. So that partnership between the oncologists and our broader cancer support team. And as Dr. Dent mentioned, also the engagement with primary care, because that is a very important component in cancer survivorship. And when I say survivorship, I really truly mean, you know, from point of diagnosis through cancer experience, through treatment for patients and their loved ones, so that their overall health needs are met. And so that's something really important. And I think somebody added to the comments that there's resources on our DukeCancerInstitute.org website. We actually just recently added a lot of videos there in honor of survivorship. And this week that have information on all of the different services that we have available to our Duke patients, as well as those that are also available to the community. So I encourage folks to check out that website to see about all those different resources that are listed there, as well as some educational videos that people can view as well.
And additionally, Komen has Thriving Together. It's a metastatic breast cancer support group. We'll provide you some information and talk about that a little later. And in addition, we also have some a care helpline that, you know, is free and available that people can also call in and get information. And of course, you can always go to our website.
Great.
All right, next question, Krista, if we have time.
Yeah, there's one in terms of, you know, this is really for women who live outside of the triangle. You know, is there a particular organization or organizations where they can receive support, and or where might someone find that information?
So American Cancer Society, as well as Komen, has a list of resources and community support groups. And I think that's the best way that you can get information. Oftentimes when Sisters Network has new people to come to our support group meetings, I ask them where did they get information about our organization, and it's either Komen or the American Cancer Society. So I think those two organizations are a good start for patients.
Great. Thank you so much. And in the interest of time, we're not going to take any more questions, but I would like to go back to our panelists, and I'd like to ask them a question. What are 3 things each one of you would tell a person who just learned of a cancer diagnosis? And I would like to start with you, Ms. Worthy, since you just finished speaking.
Let me see. So the first thing I would say is take a deep breath, because when you hear that, you feel like you can't breathe. And it's so frightening. And when I tell patients that they are survivors, even though they have not had any treatment, they look at me like, have you lost your mind? I'm not a survivor. I haven't done anything. But the fact that you survived, that someone told you that you had cancer, you're a survivor. From diagnosis, and it continues on. That's my belief. The next thing I would say is do not, and I'll say this again, do not go to the internet and research stuff. Don't do it. Just don't. You know, I didn't listen, and I read way too much, and it's just too much. Please don't do that. Wait until you see your oncologist and let them talk to you about what's going on, and then they can give you credible sites. Please, please, please. And then the third thing I think that's important, begin thinking about your dream team. And when I say that, I mean the person that's gonna be with you, go with you to your appointments, and jot down notes and remind you of what you should be doing when you should be doing it. Also, it's important to have someone that'll help you task off things. So maybe you need to go to the grocery store or whatever, but have someone to do that for you. And then it's always good to have the cheerleader. Now, the cheerleader knows nothing about your medical care, nothing about doing chores, doesn't know anything about cooking, but what she will do is make you feel good. She's just gonna cheer you on. She's gonna say, I'm sending good thoughts your way, I'm praying for you, that kind of thing. So if you can get those three people. The person that's gonna be with you, I call it the ride and die person. They'll be with you. The person that can at least coordinate the different things that you need to get done in your home life, and then your cheerleader. I think that makes, and along with your oncology team, I think that really makes for the great dream team. So those are my three suggestions.
All right, thank you. Dr. Corbett?
So I never like to follow Valerie, let me just say. Valerie just needs to close the sessions all the time. I'm trying to think three things. I might not have three, but I think probably two. One, you're not alone. Please remember that. And my second thing is to communicate. And when I say communicate, I do mean to your care team. I think I've said that probably way too much today. But also to your loved ones. To Val said, who are those people in your lives that you can talk to, who you can share your concerns, and who you can share your hopes and the positive impact that cancer can also bring to your life too, right? So I think those are probably, it might not be three, but those are two things that I hope folks remember.
Thank you so much. And Dr. Dent?
Yeah, I think my first thing I want to say is similar to what our two other panelists said. It's a team here that helps you, not just an individual. It's not just the medical oncologist, the surgeon, but we're here as a team to help you. And please, utilize that team if you have questions, whether they be about sexual health or, problems with your, how do I tell my children? We have a whole team here to help you through this. The second thing is to remember there are effective treatments. Whether you have early stage disease or advanced breast cancer, we do have options for you, and there's usually more than just one option. So fortunately, if you do not do well with one particular option in the case of advanced breast cancer, there are other choices. And so we're here to help you make those choices and get through them. And the third thing that hasn't really come up is participation in clinical trials. Across the country and across North America, only about 5% of individuals diagnosed with cancer participate in clinical trials. And it's only through clinical trial participation that we have these approval of these newer treatments that we can benefit from and patients can benefit from. So if you're approached about participating in a clinical trial, please consider it. I mean, that old sort of idea of I'm being treated as a guinea pig is not really true. I mean, these are all well-vetted protocols, and they're not always about cancer treatments, by the way. They can be about, supportive medications, anti-nausea drugs. They can be trials about your sexual health, for instance. They're not always about medications. But I think if you want to eventually cure women of breast cancer, the only way we can do that is through clinical research and clinical trials. So please consider that. So that's my third item.
Thank you all so much for joining us. Thank you, Ms. Worthy, Dr. Dent, Dr. Corbett, for taking time out of your busy schedules to come and share all of your knowledge with us. And so now I'd just like to wrap things up. Komen Breast Cancer has a helpline. It's free and it's available for those in need of breast cancer education, psychosocial support, and informational resources. So you can dial 877-GO-KOMEN or send an email to helpline@komen.org. Also, there is a Komen Treatment Assistance Program. It aims to help those who are facing financial challenges by providing limited financial assistance, education, and support services to low-income, underinsured, and uninsured breast cancer patients throughout North Carolina and our 29 counties that we service in Central and Eastern North Carolina. This financial assistance is available for breast cancer treatment expenses such as oral pain medication, anti-nausea medication, oral chemotherapy, hormone therapy, child and elder care, transportation to and from treatment, lymphedema care, supplies, and durable medical equipment. The funding of this program helps patients at any age who have been diagnosed with breast cancer at any stage of the disease. Financial assistance is granted to patients who meet predetermined eligibility criteria. Individuals must have an active breast cancer diagnosis and be active in treatment and have income at or below 250% of the federal poverty line. To learn more about this program and other resources, remember to call us at 1-877-GO-KOMEN or email us at helpline@komen.org. And then, as I mentioned earlier, Thriving Together is a metastatic breast cancer support group that meets every third Thursday of the month via Zoom, like we just did, and it was so much fun. For more information and to register for this online meeting, email mbcsupport@komennctc.org or call 919-493-2873. And don't forget to follow us on social media or visit our website. That information is going to be included in the chat box. I would just like to thank all of you for coming out, participating in this, and getting educated about breast cancer and how to be an awesome survivor, no matter what stage you are. Thank you.